Now, one key thing or aspect around medication expiration is preventing the pharmacy from having expired drugs in stock in the first place. And this is actually something the pharmacy technicians play a significant role in. In fact, I would make the statement that pharmacy technicians have a more active role in this than pharmacists do or other pharmacy professionals. So this is a key responsibility. Some principles to minimize the risk that medication on the shelf, whether it's over the counter and available directly to patients or behind the counter or in the hospital pharmacy department, is the first expire, first out stock rotation principle. So this is an inventory management practice where you go to a shelf and maybe you've got 8 bottles of acetaminophen on the shelf. You're going to make sure the ones that are expiring first are at the front of the shelf, so that if it's over the counter, if the patient's going to grab those, they're inherently going to grab the one that's going to expire first. Or if it's behind the counter in the pharmacy or in the hospital pharmacy department, then the employees that are using those for medication fills are grabbing the ones that are expiring first. Because if you have one at the back of the shelf that's going to expire sooner and it sits at the back of the shelf for several months, it has a risk that it's going to reach its expiration date. Also, doing monthly expiration date checks is an important operational safeguard. Nowadays, with electronic tracking of inventory and the use of barcoding across the entire supply chain, there's the ability to have software alerts as well. So more sophisticated inventory tracking systems will track not only the amounts of medication that are located in the pharmacy, but the individual lot numbers and expiration dates for the stock that's on hand. So if you're lucky enough to work in an environment that has that level of information technology use, that can be automated. There's also the ability to add stickers or labeling systems to medications that are maybe short dated, so they're going to expire soon. And then right sizing inventory levels is important as well. So this is another operational safeguard that you need to have a good inventory management system to ensure that you're stocking enough medication to fulfill the needs of the patients that you're serving, but nothing more than that. And that is not only an important cost control and efficiency control, but that also helps to ensure that you're not overstocking and therefore at risk for having medications go out of date. And all of those concepts are going to be expanded upon in much greater detail in the inventory management portion of that course.